The next topic is reimplantation or revascularization. When we talk about reimplantation or revascularization, what does it mean? Reimplantation or revascularization means it is actually reconnecting a severed part of the body. What is the difference? Reimplantation means when you are reconnecting a totally severed part to the body cavity. That is reimplantation. What is revascularization? Revascularization means that part has retained some attachment to the body and it needs to be revascularized. Right? Both are almost identical in the clinical approach. One is a dismembered portion, another is a severed portion with some attachment. But basic procedure as a surgeon is exactly the same. But there is a slight difference. When a part is dismembered, for example, it happens in an area of a remote area and the patient has got a severed digit. What will you do? You have to take this digit. All the centers will not have a feasibility of a microvascular anastomosis. So you have to take this center to a center where the facilities are available and then reconnect it, isn't it? So that time is also crucial. The way in which you transport is also crucial. And how will you do is also crucial. What is it called? The time between the dismembering and the revascularization is called as a cold ischemic time. Right? And the cold ischemic time is so pivotal because it varies with different organs and the different systems, isn't it? For example, if you take the cold ischemic time for the heart, it is 4 to 6 hours. If it is lung, it is ideally 2 hours. If it is heart lung, it is 4 to 6 hours. If it is liver, it is up to 12 hours. Kidneys, now I say 48 hours, but ideally it is 12 to 18 hours. Pancreas, it's 12 to around 12 hours, 6 to 8 to 12 hours. And if it is small bowel, it is actually less than 2 ideal, but you can even extend to 12 hours. In cornea, you can wait up to 18 to 20. Nobody waits for a day or two to transplant. These are maximum extension quoted in the figure. But ideally, I would say cornea within 18 hours, kidney within 8 to 12 hours, the liver and the pancreas is best done with 6 to 8 hours, heart within 4 to 6 hours, and the lung within 2 to 4 hours. And small bowel ideally falls in the same group of 2 to 4 hours for an ideal take. Right? You can try as a delayed thing, but it has to be. For digit, it is 4 to, or digit or the limb, it is 4 to 6 hours is a cold ischemic time. And many a time you get because the cold ischemic time has now has been even picturized in movies, and there is a movie called as Traffic, which is entirely based on this concept of a cold ischemic time of heart, isn't it? So basically, it is the time by a dismembered organ reaches and vascularized, right? And there are methods to keep it long also, but I'm talking about the ideal timing. Now, how will you transport a dismembered digit? And if you are seeing the patient, what you need to do is you take the first what you do is you wash the digit in saline. Then you wrap it in a sterile gauze. Then the sterile gauze is put in a plastic container, and that plastic container is put in another plastic container with ice and transported. Never put it directly with ice or never soak it in water, but a moist gauze is ideal, and it should be transported in a low temperature 4 to 14 degrees, right? And close contact with ice, direct contact with ice will cause tissue crystallization. And this digit reaches the center. What will you do? You have to see that whether it is a favorable indication or an unfavorable indication. What are the indications? Indications are ideal when there are multiple digits. And if there are multiple digits, you choose the thumb first. Right, I'll come to that story. Then wrist and forearm. When there are sharp amputations, they are preferred. Then single digit amputated between the proximal interphalangeal and distal interphalangeal joints, and all pediatric amputations. But the most favorable indications are when the amputation of the thumb at a location proximal to IP joint, amputation of 3 or more fingers or children. Relative things are the thumb distal to the IP joint, amputation of 2 digits and women, and then whenever the small amputation of the tip of the fingers after the flexor digit or superficialis insertion, you need not reimplant. Now, you transfer this center into a center of excellence. You have got a 5 digit to amputate, to reconnect. Which digit will you choose? You just imagine which digit will you choose. You have to choose the thumb first. Why? It is a thumbs up. Because the importance of the thumb, once the thumb is for secured, even if you take a long time for other digits, the limb is saved, or the functions are saved. And you remember the story of Egalevia. Dronacharya never asked for little finger, he asked for the thumb of Egalevia, because the thumb is so vital. I always say Dronacharya is a worst teacher because she sacrificed a brilliant student to another brilliant one. So, but he chose it for some other reasons, and there are a lot of explanation for that. For me, it is not the right. I don't have any explanation for that. But what the point I want to convey is the thumb is the most important thing. Now, how will you reconnect these fingers? There is an order. It is not just like anything. There is an operative sequence. First is you locate the neurovascular bundles, debride. And the first and the foremost thing you fix is the bone. You have to fix the bone, repair the extensor and the flexor tendons. Once you do that, repair the arteries, repair the veins, and repair the nerves. Right? Or repair the arteries, nerves, and the veins, and then provide a skin cover. So, begin with fixation of the bone, extensor tendon and the flexor tendons, artery, nerve, and vein, and then the skin. That is the order of fixation. And always attach a probe, a pulse oximeter probe or a tissue probe to look at the oxygen saturation. All patients should be heparinized and they should be washed. There should not be any tight bandaging. The bandaging just to take care of the cover of the wound, but tight bandaging will include the microvascular circulation, so that should be avoided, and the patient should be heparinized and monitored, and then you periodically inspect whether the limb is taking. So that is a very important aspect with regards to the reimplantation. And revascularization is nothing but you go the same order, because there is some skin attachment or the tendon attachment. You always connect the bone first and then get on with the sequence of fixation, and that is the management protocol for revascularization and reimplantation. And the most important things for an entrance point of view you should know is how will you transport, what are the cold ischemic time, what is the order of fixation, what are the order of fixation when there are 4 or more digits are amputated, and what is the indications, what are the favorable indications, when will you do a digital reimplantation and revascularization. With that, I have completed very important topics for today, that is the chest injuries, the neck injuries, blast injuries, the missile injuries, reimplantation, and the revascularization. So this actually completes the major trauma. Now the topic that is left behind is abdominal trauma, which we'll discuss in the next session. Thank you very much.